Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today I shall be talking on iron implication in Alzheimer's. Yes, iron is one of the most important minerals in the body because without the iron we wouldn't be able to have hemoglobin, and without hemoglobin you can't have oxygen get into all the cells and tissues, organs of the body. But when there is a deficiency of this iron, there is a problem. And one of the areas that is affected is the brain. So when there is an iron deficiency anemia, you can see the person experiencing dizziness because the brain is not having enough of oxygen. And when there is a problem of iron overload, when you have taken too much iron, there is also a problem that affects the brain and other organs. But we have known for sure that iron deficiency will cause dizziness, but we have not been able to know what the iron overload will cause the brain. But there is that implication. So research works on this is what I also expose. And also the stages, I shall be exposing the stages of Alzheimer's so that we can prevent it so early if possible. And then we can also use whatever knowledge we have gathered on iron stages too, because before the anemia happens, there are about 3 stages of iron depletion before its total depletion when it affects the hemoglobin formation. But like I've always said, stick on. Let's move into the slide session where you shall have an enriched delivery of what is in my upstairs. The outline: objective, introduction, iron depletion stages of Alzheimer's, research findings, and recommendations are all I shall talk about. The objective: to expose the effect of iron depletion, iron deficiency anemia, and or iron overload in the brain through medical laboratory investigations, and to expose the stages of Alzheimer's and how iron overload could also be implicated. Introduction: iron is an essential element for man and almost all living organisms as it participates in a wide variety of metabolic processes, including oxygen transport, deoxyribonucleic acid synthesis, electron transport, and as a component of enzyme involved in the synthesis of collagen and some neurotransmitters. Iron in excess in the brain causes ferroptosis. So the brain has mechanism to regulate iron absorption, but it can still experience iron overload, which can be detrimental to brain health and function. While the blood-brain barrier normally protects the brain from excessive iron, factors like aging, neurodegenerative diseases, and even alcohol consumption can disrupt iron homeostasis and lead to accumulation in the brain. Yes, let's use this picture to understand Alzheimer's and the effect. Healthy brain size, that is what you see up there. And what is contained inside it are healthy neurons, the brain cells. You can see the picture below. And once that neurons start dying, you see them dying neurons will tangle. They now form plaques, and that's the shrunken brain with Alzheimer's disease. You see the size of the brain is reduced, and there are so many plaques. The plaques are more or less taking hold of where all the healthy neurons should be. So it's a neurodegenerative situation that is being shown clearly in this picture. Yes, this photo shows clearly the plaque and the normal brain tissues. Yes, let's look at iron depletion stages. Ferritin is the primary protein in the body that stores iron. So when you talk of ferritin, you are talking about stored iron. Thus, measurement of the ferritin level provides a very good indication of the size of the body available iron stores. The ferritin level decreases before symptoms of anemia occurs. That is, once the level of iron is depleted, then there will be no iron for producing immunoglobulin. For example, in stage 1 of iron deficiency anemia, ferritin and hemosiderin stores are depleted. In stage 2, the serum iron decreases and the total iron binding capacity increases. That is common sense anyway, that it can bind more. Then in stage 3, it is not until this stage that the hemoglobin level is decreased and the iron deficiency affects heme synthesis. That is what I had earlier said, that the hemoglobin will not be produced because there are no iron. It is the heme that makes the synthesis possible, hemoglobin possible. Assessment of the ferritin level in conjunction with the determination of iron level and total iron binding capacity is used in the differential diagnosis of the various type of anemia, more like saying the laboratory diagnosis. Ferritin in male is 12 to 300 nanogram per ml, or in female 12 to 150 nanogram per ml. Alzheimer's stages. In Alzheimer's diseases, there are 3 main stages. That is the progression. Usually from normal, it will progress to mild, moderate, and severe or late Alzheimer's. The early stage Alzheimer's, you have memory loss becomes more noticeable with difficulty recalling recent events, names, or conversations, among other noticeable dullness. That is the picture you are seeing of the brain. Like you can see the little plaques. And by the time it gets to the middle stage or moderate, increased memory loss, confusion, and cognitive decline when they cannot understand or they are unable to learn new things. So the picture is also showing the increased plaque. You can see that it's like the brain is getting shrunk, getting smaller, because the plaques are becoming many. Then the late stage is severe cognitive decline, when you can hardly learn new things. Individual experience profound memory loss, lose the ability to communicate effectively, and require constant care and supervision. They may become immobile, experience incontinence, and have difficulty swallowing. People may be unable to respond or communicate and may be nearing death. So the 3 stages are now shown together so that you can see how these things progress. It's a gradual progression, but it's not something that could happen so quickly. Some it can take like 20 years, 40 years. But the truth is, once you start experiencing this memory loss gradually, it may not be the normal, because people always ascribe it to old age. Yes, old age could come with its own memory loss. Yeah, the research findings so far. A recent research finding by Paul Ian Cross, PhD, and fact-checked by Sarah Myers, PharmD, included too much iron in brain cells contributes to Alzheimer's and dementia. The study, led by researchers from Oregon Health and Science University, the research suggests that ferroptosis, a form of cell death caused by excess iron accumulation, destroy microglia cells. These are immune cells that help to repair or carry away dead cells, crucial component of the brain immune system. The study involved the analysis of brain tissues from diseased dementia patients. It also built on previous work about myelin, which serves as a protective coating for nerve fibers in the brain. So when the coating is exposed or destroyed, you can understand that the neurodegeneration will start. The research team found that in patients with Alzheimer's and vascular dementia, microglia deterioration in the brain's deteriorate in the brain's white matter. Another known research finding is that the brain regulates iron absorption. So it does not just allow iron to come in unregulated so that it can easily be overloaded. But the brain maintains iron homeostasis through various mechanisms, including the blood-brain barrier, which controls the entry of iron into the brain. The brain cells also regulate iron uptake and storage through specific proteins like transferrin receptors and ferritin. This receptor would allow in, without the receptor, nothing can come in. So probably the receptor could even change the configuration and the iron will not be able to come in. But however, this mechanism can be overwhelmed, leading to iron overload in certain brain region. What could overwhelm it? We can think of aging. When we age, there is that tendency of losing this control. The neurodegenerative diseases could also cause it. Alcohol consumption, blood-brain barrier disruption, microorganisms injury or even inflammation could cause the disruption. Iron catalyzes formation of free radicals, leading to oxidative stress. The oxidative stress too would surely cause these damages because the reactions, once there is a reaction like the DNA mutation, it could also happen in this kind of situation where there is damages done and the barrier is overwhelmed. While iron deficiency has been linked to cognitive issues and increased dementia risk, particularly in early life and in females without hypertension, excessive iron intake, especially in males, has also been associated with higher dementia incidence. Iron accumulation in the brain is also implicated in the progression of Alzheimer's and vascular dementia, as it can lead to oxidative stress, as I had earlier pinpointed, and cell death. Iron accumulation is observed in the brains of individuals with Alzheimer's and other dementias, particularly in the protein clump, the plaque that entangles that are earlier shown. You can also see it in this picture associated with the disease, microglia and ferroptosis. In the brain of individuals with Alzheimer's and vascular dementia, microglia, immune cells in the brain, can deteriorate due to iron accumulation, potentially leading to cell death and worsening cognitive decline, according to medical news today. Finally, recommendations. It is recommended that one performs the assessment of iron store in order to determine iron depletion or iron deficiency anemia. Ferritin levels directly reflect the amount of iron stored in the body because iron is stored as ferritin in the protein form. The blood test recommended in a serum ferritin test, and when elevated, it indicates iron overload, especially in a condition like hemochromatosis or even in hemosiderinosis, that is where the iron it looks light red cells are now stored, and you see the skin discoloration, brownish. A low ferritin level can indicate iron deficiency, which may lead to anemia. Once the level is low, it's like the iron is getting depleted. The slide films reading of microcytosis in the hematology lab especially is indicative of iron deficiency anemia, among other hematological parameters. Transferrin saturation tests could also be done. So when elevated, indicates iron overload. Histological studies like shown on slide could also be done. MRI technique like QCM, a T2 mapping, all there. with the understanding of some assertions, like for example, disruption in iron homeostasis, whether through deficiency or overload, can lead to neuronal damages and dysfunction, contributing to neurodegeneration, shows clearly that iron deficiency anemia may not stop only at dizziness. It could extend, can lead to neuronal damage and dysfunction, contributing to neurodegeneration, especially when one grows older, when the cells cannot quickly repair itself. You could, I think at that stage, one should be very careful of iron deficiency anemia. So, somebody experienced something like that, and the person even recommended to himself, after he had gone to do the necessary tests and there was no test done on iron deficiency, but he bought blood tonic containing hemoglobin and vitamin B12, and it became handy. It corrected his dizziness and could even boast to me. So it could be a recommendation at old age to forestall experiencing azemia, especially those whose protein source are plant protein like beans that are non-heme iron, that usually the iron are readily absorbed by the body, because animal heme are very easily absorbed. The plant has to go through process, not totally absorbed, but regardless, at least you have blood in you, unlike when you don't have. But it is better to also supplement it with hemoglobin source. You can watch more of my videos on this YouTube channel. You have as many as over 187 right now, and we are still on. It's all on health issues, and I'm sure by the time you have anyone, you can always get more knowledge on health matters. Health is wealth, knowledge is power. Subscribe if you really want to encourage more production. Thank you.